besides me?
Yeah, so I think a really important thing to understand about arthritis is there are two different categories. Can you guys hear me?
Yeah.
Okay. There's two big buckets of arthritis. There's the wear and tear type, and that's called osteoarthritis. That's akin to tires of your car wearing out over time. It's natural. You know, I have folks that come in and say, my knee's worn out. My mom had it too. I have arthritis in my spine. My parents had it, and so I inherited it. And the reality is, we're all going to get it. It's natural. It's like gray hair and wrinkles. Now, your lifestyle, if you're a smoker, if you've worn your body out, if your genetics predisposes you to getting a more rapid degeneration, that there's truth to that. So that's called osteoarthritis. That's a huge bucket. Everybody on the earth is going to get it. There's nothing you can do about it except lifestyle changes and just take good care of yourself. But there's no medicines to reverse it to date. But we do have some techniques I'm going to talk about to preserve your joints and tendons. The difference is inflammatory arthropathy, which is what Danny suffers with rheumatoid arthritis. That's a huge bucket. There's over 100 types of inflammatory or autoimmune arthropathies. And this is basically totally different. This is a full body issue. The body actually is erroneously attacking the lining of the joints, which is called the synovium, and it's seeing the lining of the joints as, in essence, as a bacteria or virus. So your immune system is like a teeter, like a seesaw, and every day your body is doing a pro-inflammatory and an anti-inflammatory constantly. But due to genetics and life happenings, some people's pro-inflammatory goes crazy and the body starts to attack its own lining. That's called inflammatory or autoimmune arthropathy. Rheumatoid arthritis is the most common one we hear about, but there's many different types: psoriatic, ankylosing spondylitis, all different types. And there's a little bit of mixes. The difference is that does have medication you can take, injections, infusions. Danny takes some of those. When I started 25 years ago, we had methotrexate and gold shots for that, and that was it. So 25 years later, we've got lots of these disease modifying medicines to help these people have, functional lives, such as Danny running a company. She's runs in a company. She's an entrepreneur. She builds houses, largely due to her intentions, her body, mind, spirit, her injections that she gets. The reason it's important to be on medications for those is because it can actually affect your end organs. So autoimmune arthropathies, unlike osteoarthritis, which is just your, wear and tear, can cause damage to the heart, lungs, kidneys, and things like that. So it's important to modify or balance that immune system so that the person can have good quality of life and longevity. Um,
I love it. Thank you. That
you're
was
welcome.
amazing. I mean, you and I even took. I'm taking notes.